My name is Dr. Ilya Skolnikoff. I'm excited to be here today, bringing you this incredibly valuable information about thyroid dysfunction and hormonal imbalances. You already know my name, and I'm the Clinic Director of Tri-Iodothyronine Family Healing Center, where we specialize in helping women with hormonal imbalances and people who have trouble with their thyroid. This is Yvette here, helping us with some demonstrations regarding the thyroid and hormonal imbalances. Okay, and have you ever had trouble with your thyroid or hormonal imbalances or weight or temperature?
Yes, I did.
Okay.
But nobody told me before.
Nobody told you before. Sounds familiar. So let's look at some of the ways that we can find out and treat these disorders that have never, ever been done before. We're literally going to give you 5 or 6 secret ways to not only diagnose these kind of thyroid and hormonal disorders, but also to treat them. Okay, we're going to focus more on the diagnosis right now. So the first one is, can we have a communication with the person's body? I'm a diplomate of the International Board of Applied Kinesiology. If you want to learn more about what that is, you can go through the internet, and you can also go through this website, tri-iodothyronine.net. But basically, I'm an expert at understanding what are the underlying causes of people's health concerns. So, when it comes to thyroid conditions, we want to see what's going on. So first, we need to see if the body is telling the truth, because people's bodies lie all the time. You can learn about how people's bodies don't lie. It's kind of a little different than what I'm saying in a book called Your Body Doesn't Lie by John Diamond. But the truth is that people's bodies do lie quite often. So first we check these nutrients. If she's deficient in B12, folic acid, parotid, or ribonucleic acid, then her body may not be completely honest for a variety of reasons. Those are 3 nutrients that are incredibly important for proper thyroid health and for proper cellular health and for the division of the cells and for T3 being able to allow the cell to function properly. T3 is thyroid hormone, it's Tri-Iodothyronine. It's a combination of 3 iodine molecules that bound together to a protein, which is then called Thyroglobulin, are able to be delivered to cells and then allow the cells to change their metabolic activity to increase or to grow or decrease in size. It's not exactly how it works, but I'm trying to give a basic idea of how it works. So first one, cataplex B12. She does not need cataplex B12, good for you. She's not deficient in cataplex B12, ribonucleic acid. She doesn't need that. Good for you, Yvette. You're not deficient in ribonucleic acid. And parotid, good for you. Parotid is necessary to tag the food that's eaten with saliva and other digestive juices like salivary amylase and protease and lipase and whatnot, and then allow it to be recognized when it's swallowed and digested further down the digestive tract. Now we're going to find out about Ileocecal valve by making a fist, putting it here, and seeing if there's trouble with the Ileocecal valve. Ileocecal valve, she doesn't seem to have trouble with that. That's related to digestion. And if you can't digest protein and you can't digest iodine, then you can't make thyroid hormone. That sounds pretty important. That's going to lead to some troubles with energy, because if you can't get energy from your food, you're going to you're going to be tired. You're not going to be able to metabolize the hormones that you need to metabolize. You need these nutrients to be digested properly to metabolize the hormones, right? Right? Right. Okay. Then we'll check bowels of Houston, another aspect of digestion. That's a valve that's part of the anus, okay? And that one, wait a second, Ileocecal valve, bowels of Houston, seems to be working okay. Eyes closed, bowels of Houston, eyes open. Sometimes there's a hidden, these are like circuits that could be out. Sometimes it's hard to find it, so we could have her close her eyes or open her eyes. We could have her wear an eye patch, for example. Let's try putting this eye patch on your left eye. Okay, please, Yvette, thank you. And then we'll check the Ileocecal valve again, the valves of Houston again. They seem, we can take it off. They seem okay. So this is a whole science. It's very involved. Then we can check blood sugar. We put 3 fingers here. Okay, but it just so happens that blood sugar is really, really important with these thyroid and hormonal imbalances. So we want to have another way to check blood sugar. Let's see, what can we do? Hey, I have an idea. Please lie on your back. So Dr. Viktor Frankl, the great late Dr. Viktor Frankl, who just passed away about 6 years ago or so, he gave us Total Body Modification. Total Body Modification. And so we can use Total Body Modification, that's now owned by Kevin Millay, to look at the body differently and see another way for checking for these hormonal imbalances, or actually to check for blood sugar imbalances. So that's what we're going to do. We're going to see if there's any blood sugar imbalances a different way. So push straight up into my hand here, breathing normally. Push, 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 push. Okay. Knee straight and come lower and push again, breathing. Okay, actually that muscle's not locking properly, so that would demonstrate hyperglycemia. Okay. And then we'll check this side, push straight up here, breathing. And that one is working properly. That's good. So she has hyperglycemia. This one checks for hypoglycemia, so her blood sugar is not getting too low. It's just a little bit too high. Okay. And then we could support the blood sugar. We could then give her, some type of a therapeutic input, like a homeopathic remedy, a chiropractic adjustment, a flower essence, or something like that, and see if that were to change the hyperglycemia. Okay. And then we can check the blood sugar circuit related to the adrenal glands and the pancreas. So go ahead and keep your elbow straight and pull your arm straight back that way towards your buttock and the ground beneath you. So you're just going to push in towards the ground beneath you, and I'm pulling out. Don't let me. Now keep your elbow straight. Okay. Okay, yeah, so that muscle comes out, that arm comes out a little bit, and same thing here. Pull down towards the ground and into your body. Don't let me pull out. Okay. Then we can try them both at the same time. Pull down to the ground beneath you and in towards your body. Don't let me pull out. Okay. So yeah, so these are circuits that are out, so that circuit's a little bit out as well. Okay. And again, these things are common, very, very common with people who have trouble with their thyroid. So common, in fact, that's the #1 cause of thyroid disorders, is an imbalance in blood sugar that then inactivates the conversion of T4 to T3. So the high level of sugar in the blood, which leads to increases in cortisol, prevents the conversion of T4 to T3, T3 being active thyroid hormone, Tri-Iodothyronine, and T4 being inactive thyroid hormone, thyroxine. Okay, we'll check a few other things. We can check how well she's metabolizing water by checking the psoas muscles function. Push straight up here in my hand, breathing. Okay, that psoas muscle seems to be working all right. And push up here into my hand. That one not working so well. But sometimes the patients are tricky, so we have to know how to do this. It's like an art and a science. Push up here into my hand, breathing. Okay, and actually that psoas muscle is also not working. So it's possible that there's trouble with water metabolism. We'll have Yvette drink some water and then leave some water in her mouth. Go ahead and let's have you drink some water and leave some water in your mouth. Don't swallow the water that ends up getting in your mouth there, so that we can see how the water influences you. Okay. Push straight up into my hand. Oh, that helped. Push straight up into my hand. That helped. That's it. We're out of time. Thank you for joining us.